So our group did our community assessment in Guilford County, North Carolina, focusing on teen pregnancy. The windshield survey of Guilford County, the boundaries are between Highway 220, I-40, Aycock Street, and I-29. Most of the houses within this area were wood with siding, all built between the 20s and the 50s. Many with no AC units appear disheveled as far as the yards, the windows, and appearance, but all with modern plumbing. There are a lot of parks and playgrounds. Some of the open spaces were used as dumping areas and were unkept with unmowed yards, and others were well kept up parks. As far as commons, people congregated in these parks in the evening. And there was a city park that was really popular, noted, where people tend to hang out with fountains and beaches, and then around it is shopping centers and churches. The main mode of transportation was private cars, but second to that is a bus system that is done really well. It's very extensive and goes into the city and the nearby towns. There are a few bicycle routes and a train station that's not as popular. There are a lot of clinics in the community, medical and dental offices, several homeless shelters, and community centers. A lot of churches were noted, mostly were Protestant churches, a few Catholic churches. We also saw a Jewish place of worship, Muslim place of worship, and a Universalist place of worship. The ethnicity and race really varied from area to area. Some places had mostly African Americans, while others were highly populated with Hispanics or Asians or Caucasian. The condition again kind of varied. Some areas were very beautiful, others were very rundown lots covered in trash that needed to be cleared out, abandoned properties that seemed dangerous, but downtown tended to be thriving and kept up well. Businesses and industries, a lot of textile places, hospitals, banks, and there's a large shipping hub that's really popular and has several employees. There's a main library, which is the main place for media, and a lot of people walking with music and headphones in were seen as well. There's a city hall, which is really popular. There were several posters out that noted a recent protest done there. In health indicators, there's medical and dental offices in several hospitals noted. There are a lot of people out and about walking. The only animals seen were on leashes and were pets. Other than that, just squirrels. There are a lot of areas with several homeless residents and people sitting outside on their porches and their swings. Stores were pretty typical shopping centers, grocery stores. There was a prominent farmers market on Saturdays that's very popular in Guilford County, but nothing in particular other than those things. As far as the data analysis, Guilford County is the third largest county in North Carolina. You can see above the estimated population, which is higher in 2014 than 2010. And as far as ethnicity, it's mostly Caucasian. Second to that would be African Americans. The average median income was $45,431. 13.4% of the families live below the poverty line. 50.8% of single moms are below the poverty line, and 25.8 teens. The unemployment rate is 5.8%. As far as housing, you can see above the number of units that require mortgages, that don't require mortgages, and that are just the average gross rent requirement. This is pretty average to North Carolina as well. Hospitals in the region, there are about 6 hospitals. The most popular is Moses Cone, and then High Point Regional Women's Hospital is where a lot of the teens actually deliver their babies. So we'll talk about that in a few minutes. It's a level 2 women's center and a level 3 NICU. There weren't any major health issues. A lot of people noted on the website that they had asthma and allergies, and that could be due to the unkept nature of a lot of the city. But other than that, there were no major health issues. There is kind of an issue with crime in Guilford County. Both property and violent crime rates were 64 and 65 out of 100, which is kind of high. So Cone Health goals for healthy pregnancy, they kind of put out some goals that they had for teen moms. The first goal was to develop a care coordination model, reducing the number of teen pregnancies. Then another goal was to help with access to prenatal care for expectant teens in the first trimester. And then the third goal was to improve healthy baby outcomes by discouraging tobacco use, encouraging breastfeeding, and most of that um, goes hand in hand with education for these teen moms. Pregnancy prevention programs, the most common is called Smart Girls. Um, this organization provides information to young girls. It gives them the skills to be healthy and successful and make good choices, set goals for their future, and strengthen family connections. We talked to a young girl named Beth C. Um, she participated in this program a few years ago when she was a teenager, when she was unexpectedly pregnant, and they provided her with her choices, whether to keep the baby, give it up for adoption, or have an abortion. She decided to keep her baby, and they gave her the support she needed, and she's now in her last semester of nursing school. Her story was really cool. She really spoke highly of this program and thankfully was one of the successful people. Um, there are a few healthy education teams within the hospital that help these teen girls by encouraging abstinence and providing education and resources for those who are already pregnant. Here we have several charts just with a breakdown of women by age and race according to the average age of the mom and what number of child it is. So for example, um, all women here, this includes all races, age of, say, like if we look at age of mom, a 13-year-old, there were 3 with her first child and 0 with her 5th child. For white non-Hispanic women, here's a chart um, which shows so 19-year-olds, there were 33 with their first child, and here African American 19-year-olds, 64 with their first child, and this is all in 2013. And for Hispanics, 27 19-year-olds with their first child. So African American in 2013, the age of 19, had the highest rate of pregnancies. We looked at a youth risk behavior survey that surveyed high school and middle schoolers. You can see there were 2,642 middle schoolers surveyed and 2,326 high schoolers that were surveyed. 3 out of the 4 high schoolers and half of the middle schoolers had discussions with their parents and family about sex and pregnancy prevention. Youth survey continued education for students. North Carolina requires that sex ed be taught in 7th, 8th, and 9th grade. And this has to be factual information that's presented to these students, including pregnancy prevention and abstinence. Survey results, 49.4% of teens said that they were active in 2013 as opposed to 37.3% in 2011, which is a huge improvement. It's lower than the North Carolina average and it's declining, which shows that education is happening for these students. 1 out of 14 had sex before they were 13 years old, and there was a lower percentage before the age of 13, 7% in 2011 and 9% in 2003. So again, the rate of students having sex has decreased from 2003 until now. So medical care for these teens in North Carolina, you have the right without parental or guardianship approval to obtain contraceptives, HIV, STD testing, pregnancy tests, and prenatal care. Anyone can purchase condoms, and you can purchase emergency contraceptive if you're over 17 years old. 3 strengths related to teen pregnancy. There are many healthcare facilities available, hospitals available to these kids or teens, adolescent pregnancy prevention programs, including Smart Girls and another one called Matter of the Heart, and sex ed in 7th, 8th, and 9th grade is provided to them, which we just talked about. So those are 3 strengths in Guilford County as in relation to teen pregnancy, and 3 community weaknesses would be a lack of education. Although there is sex ed, many teens are still having sex. We know it's declining, but 32% of pregnancies are um, are girls between the ages of 15 and 19 and were repeats. And then we see 37.7 high schoolers were sexually active and 17.4 middle schoolers sexually active. So there still is a need for education, for more education. Another weakness is poor promotion of communication between adolescents and their parents, which would really help open conversations up for these children. And the third would be breastfeeding education is lacking. Um, Mothers under 20 exhibit the lowest rate of breastfeeding, and there were no resources that were really found to help these adolescent mothers in Guilford County to breastfeed. Health problems. Again, teen pregnancy. In 2010, 807 Guilford County girls between 10 and 19 got pregnant. Um, Teen pregnancies are known to be linked with infant malnutrition, and teen mothers are less likely to go back and get a degree from school. Um, and it's a known fact that children of teen moms are more likely to become a teen parent. So these are some issues that are really, really big with teen pregnancy, and we want to help prevent if possible. Areas affected by teen pregnancy, the community as a whole is affected as taxpayers contribute to these supporting teen pregnancies. Teachers have to try to work with these students. Families are affected as they try to help a child raise a child. And level of community awareness. The Guilford County website identifies teen pregnancy in 2011 and 2012. They posted that youth risk behavior survey, which we talked about, and it's allowed for the public view. So that is a good place where the community can become aware of the issue with teen pregnancy if they read the results that are published every year on the Guilford County website. So is this a high priority in the area? MyGuilfordCounty.com recognizes poor birth outcomes as a health priority in the community. This is related to teen pregnancies if adolescents don't seek prenatal care, but there's no specific priority related to teen pregnancy. Potential nursing and health interventions. Nurses could provide education on abstinence and safe sex at checkups. Nurses could promote open communication between teens and patients and parents to help build trust, provide education as far as breastfeeding, and encourage prenatal care for these pregnant teenagers. Strengths and programs. The community has multiple healthcare facilities and resources available, which is a strength. Teaching sex ed in school is a strength, and that's an asset in a program. There are resources like we talked about, Matter of the Heart, Planned Parenthood, and Smart Girls. And as far as limitations to resources, they all kind of focus on pregnancy prevention and aren't as big. There aren't as many programs that offer support for those who are already pregnant. And support is really, really important for these adolescents who already end up pregnant and need help. So Cone Health could have an outreach program that offered primary, secondary, and tertiary care for these teens. Primary care would be to have people volunteer at schools, speaking to the students and provide information and help. Secondary care would be prenatal care for these girls, and then tertiary care would be support groups for these moms and offer assistance. Lastly, we learned that although a number of teens become pregnant has decreased, there's still a big issue, still a need for education and help. And as nurses, we need to be aware that there is a gap in education and help provide these kids with resources that they need, help answer their questions, and encourage conversations with their parents to help them to be successful and not to fall into the statistics of being unemployed and under the poverty level and continue to have repeat pregnancies. Thank you so much, and that is the conclusion of our presentation.